Many of you have asked if or when the state will move towards a stay-at-home policy. The answer is not at this time. We're following the facts related specifically to the state of Arizona. The CDC isn't there yet. Arizona is not there yet. We're not at the same stage as other states. And today, on a call with the state's governors from around the country, the Vice President made it clear there have been no discussions about a nationwide lockdown by the President's coronavirus task force. As I travel around the state, it's obvious that citizens around the state are already staying at home and acting responsibly. There's empty streets and empty sidewalks and traffic-free highways. But we all know the risks. The virus is most harmful to those we love the most, our grandparents and our parents. All of us should heed the advice of public health officials. These are unprecedented times, and our approach has been to proceed with a calm and steady manner and with a sense of urgency, and to provide certainty wherever possible. To that end, today I'm issuing another executive order for the employers, families, and citizens across the state that details what are essential services. Again, we are not implementing a so-called shelter-in-place policy as other states have done. This is a proactive and administrative measure that ensures that the state has one consistent, overarching policy that is based on CDC and public health guidance so that the people of Arizona across all jurisdictions, cities and counties have clarity and consistency. As we've seen, commercial partners are looking to build capacity for testing, with Banner Health standing up 4 drive-through testing sites today and more to come. To guarantee our public health experts get the data they need to accurately model the spread and plan ahead, today I'm issuing an executive order for enhanced surveillance, requiring commercial labs to provide laboratory specimens for in-depth analysis and sequencing. It will also require commercial labs to provide denominator data on their testing, something that to this point has been provided voluntarily by our commercial lab partners. I think that any of these deaths around this infectious disease are tragic. I want to see everyone have the ability to get a test, certainly those that are symptomatic and sick and have the conditions of the gentleman that passed because he did have underlying health conditions, that he should have access to that. Dr. Christ has addressed what we're doing around these tests, how we've expanded our testing capability, how we have 4 areas and locations right now for drive-through testing, and we're grateful to Banner for doing that.
So there are not enough test kits right now to test everybody who would like to be tested. We're prioritizing those high-risk patients and then patients with symptoms. And out of those patients with symptoms, prioritizing those hospitalized patients. I don't have the figures because so many of the labs now are coming in through the commercial labs. I don't have their current status or follow-up.